Great. Peter, have anything you want to share?
Well, these guys are great. I had some great ideas. I thought I was the only extractive industry. I agree with Everett, primary care, and that applying that to dentistry as well. There are some moves in some states for other categories of dental therapists to assume some of the preventive public health duties and functions. I think that's key to moving away from scarce access to a system where people can access dental care. In terms of national policy, I would also caution over exuberance, and I can see a what's the word I'm looking for? I can see a minimal involvement of dentistry for relief of pain, coordinating with the medical community and the hospitals in that regard, and then see how that goes, and maybe build from there. But I think the cost can accelerate really quickly. I did want to mention that when Wendy showed that pie chart, expenses for dental care are well under 10% of the big, the whole pie. So it's not a big part of the pie, but I think it's an important part of the pie that we occupy.
Thanks, Peter.
Okay.
Jay, representing primary care. Lots of support.
Medicine has dropped the ball. The term medical industrial complex popped into my mind today. I said, oh great, I've coined a new phrase. And so I typed it into my search engine, and a guy named Arnold Relman, who was my teacher and was an editor of the New England Journal, had used that term in an article in 1980. We used to be the patient's advocate, and research used to come from universities and from the government, and we were able to use that information to act in the best interest of our patients. Over this last 25 years, it's been turned completely on its head. Most research now comes from pharmaceutical companies. About 80% of it does. Those studies that are sponsored by pharmaceutical companies are 5 times more likely to show that that drug has a positive effect than studies done by governments and universities that aren't sponsored by pharmaceutical companies. So I no longer drive it well. Actually, you will see me in the hospital if you're in the hospital and you're my patient. But 90% of the physicians who I have worked with at Exeter Hospital in primary care now no longer see their patients in the hospital. There are 6 of us left or 8 of us left to do that. And you will not get those people back. It will be much longer than 3 to 5 years, I'm sorry to say, because they will not come back into the system, even with financial incentives, because they like staying home with their children, and they like the relaxation, and they don't like to be all night long. So you're going to have to train people from the grassroots, and it's going to take years, if not decades, to convince people going into medical school that primary care is the right way to go. It was a very, very difficult thing for me to choose primary care in Boston in 1986 because everyone tried to convince me that that was not the right thing to do in Boston. It might have been different if I was in North Dakota or Wisconsin or perhaps in Maine, but that was certainly not the case in Boston, so it's going to be much longer. So we've dropped the ball, and primary care in particular needs to be able to become, once again, the patient's advocate and really work towards making sure that the decisions we make are, first of all, the correct ones for our patients, and then secondly, the most cost-effective decisions that we can make. We don't do that anymore. And all of the paperwork that drives me most crazy is the paperwork driven by pharmaceutical companies and insurance companies trying to second-guess what I do to keep the immediate costs down as I try to look at a much bigger picture in the long-term care of my patient. There's no interest anywhere else in doing that in the medical industrial system, unfortunately. So not only does it require the physician, but of course it requires the patient, because really the patient's the moral power. You choose the physician, and you choose the drug you choose to take, and you choose the insurance you choose. We all have to do it as a team. It's not going to happen by insurance changes. It's not going to happen by physicians doing it on their own. I hope that what you've described, Tom, will be an effective, cost-effective, cooperative system. I hope we can all be friends in 5 years. There'll be new friends, by the way, because all primary docs will be gone. But there'll be new docs, hopefully, to take their place.
Great. Thanks, Jay. Helen, I don't know if you have anything you want to add to what you said before, or if you're...
Well, just very briefly, because I really think the audience is waste your time. When I sit here thinking about primary care, and I really think about the patient and about what they really need in order to make these changes that will eventually lead to these cost savings. I mean, I think you've got to get people invested in wellness and prevention. I mean, I offer appointments to be uninsured. They'll call in the morning, and if they can't get in until the afternoon, they'll still go to the emergency room. I mean, there has to be an incentive-based system where people really buy into improving their own health care, and we need to have the resources, obviously, and the support systems to help them do it. But I think you're not going to turn this huge medical industrial industry around until the patient really controls what they value about their health, and to give them the education to do that. So I really hope healthcare reform, we're not hearing very much about that in terms of how the patient gets to get that education to make the changes that they need to make.
Chris, from the employer's perspective.
I had a whole list of things that I wanted to share with you, but Judd kind of scared me, so I don't think there's just a couple things I wanted to highlight, and because I liked what Jay said, and because he's my doctor, I thought I would highlight the restore the primacy of the doctor-patient relationship, which I think is consistent with what we're talking about. I mean, I think that's critical. I mean, you know, and I think employers, they bear a responsibility for what has happened, because, you know, we've you know, as Everett said early on, I mean, we have just, you know, been pushing on insurers to, you know, do our dirty work for us, and, you know, the doctor-patient relationship has suffered, and, you know, I can't imagine how frustrating it must be to a doctor who, you know, went to medical school to treat people, to have to spend, you know, hours on the phone with some, you know, 20-year-old working out of a cubicle in Connecticut trying to explain, you know, why they did X to a particular patient. So I think that's one thing. The other thing I'll just point out here, and then I think we want to hear from you all is, you know, we clearly got to focus on prevention and early intervention and total quality of care. But the thing that I think we need to do, and that, you know, we don't talk about a lot, is we got to change our national mindset. We need to have less fast food. We need to have healthy menus in company cafeterias. I mean, it's so ironic. You know, you'll spend 2 hours in a meeting talking about how we've got to, you know, got wellness ingrained in our employees, and then you go out and you have a greasy burger and fries at the company cafeteria. So, you know, we got to be consistent. We got to be consistent. We need more bike paths. We need to work less. We need to take real vacations without a BlackBerry. We need fewer drug ads on TV. We need to get out of the sick business and into the health business.
Great. I'm going to ask Tom if you have any last words, and then I'd like to open it up for your discussion.
Well, we're going to be quick and say that this is not going to be easy. Nothing worthwhile is. I agree with Everett that it is an amorphous being, and change won't be immediate. It will have to be phased in. I do disagree with Judd about the amount of waste that's currently in the system, and going back to Wendy's statistics about where we rank quality of care in the world and where we rank in terms of cost of health care. The issue is that every dollar we now waste is part of somebody's paycheck in the medical industrial complex, or it's part of some institution's paycheck in the medical industrial complex, and that kind of change is going to take some time. So I'll leave it at that. Why don't we open up for questions?
Great.